everyone.
Hey guys, welcome to another episode of The Making of. I'm your co-host, Ashley Hovez,
And I'm Colin Samry.
and we're together.
We are actually in the same room. It's
Yes,
crazy.
like literally in the same room. And what did we just finish?
We finished our CPR training, so we are certified for the next 2 years.
Yes.
We can renew our licenses and not have to worry about that. I wanted to do kind of a fun little episode, something we haven't really done before, where I want to just talk to you about like your consults and your new patient exams and kind of that first new patient experience for someone that's coming to the office for the first time. I think you do it really well and
Thank you.
patients connect with you really well. But there are tactical things that I think anyone can do that can help them really improve that patient's first experience. So are you down to talk about that with me today?
Okay. Yes, let's do it.
And you showed me the Will Guidara, the field book,
Mm-hmm.
and it's so good. He talks about so many things, and it was like a great refresher for that Unreasonable Hospitality book. So if you haven't read that, you definitely should. He talks about this peak and end rule where, he had restaurants and the customers' experiences, the ones that they'll remember the most are like at the peak of the appointment and at the end of the appointment. So before someone even walks in, though, do you have a way that you want a patient to be greeted when they first walk into the door?
I do.
Yeah.
So we've done a lot of team trainings, a lot of just role playing in the
Mhm.
office. And one thing that I really love about the restaurant scene is you have a greeter, someone who is usually standing, and if they're not standing, they will stand
Yep.
as soon as you enter the space. Even if you go into a nice hotel or even a nice shop, like they're standing to greet you. So one of the things that I like our team members to do, whoever is the first impression of the office, I like for them to stand, shake the patient's hand, and welcome them by name. And usually, like when you walk into a medical office, they're going to ask you name. And sometimes there's a clipboard. Sometimes there's not even a person. You just sign something that says what time you checked in. So we already know roughly who we're expecting. It's
Yeah.
not like we treat walk-ins on the
Right.
regular. So if it's a man, if it's a woman, you can guess that it's probably John or Susan, and you
Unless they're
greet them.
Colin.
Yes, right. So you stand and you greet them and you introduce yourself right out of the gate.
I love that. I mean, it's just the first impression, right? And that makes you stand out from an office, like you said, where they don't even look at you when you walk in the door.
Right.
After COVID, I feel like people still have some of those plastic
barriers
100%. Up. Yeah,
Yeah.
it's not fun. So then obviously the patients are brought back. What is something that you guys do and that you've curated for Smile and Company as a patient's first being brought back?
Well, there's lots of things. One is we do an office tour, and we like to point out specific things on how the office is designed, the beverage center, the layout, the fact that we have no doors that separate the front and the back office because we wanted it to feel more like a home. We wanted it to be nice, open, and airy. And also our lab and sterilization areas are planned like a Michelin restaurant where it's an open kitchen. We want our patients to know that safety is first and foremost, and we want it to be completely visible. So you know that, hey, listen, even through the busyness of the day, our lab and sterilization areas are impeccable because your safety is priority for us.
So then they come into the room, they have their records taken by the assistant or hygienist, whoever's seeing them. that all kind of goes the same. Obviously, you want your assistant and your team members to be friendly and whatnot. But from a doctor's point of view, you're walking into the room. What is the first thing you do? Do you immediately sit behind the patients and just start reviewing the x-rays without even saying anything? Just walk me through you walking into a room.
So when I walk into a room, if I'm usually interrupting a hygienist who has them laying back, of course.
Mm-hmm.
And what I like to do is I stop and I will seat the patient upright. I think the first impression is incredibly important. And meeting a new face, especially a dentist, someone who they're already intimidated, being in the office, being in the chair, being in a very vulnerable position. I like for us to meet eye to eye. So I'll seat them all the way up, introduce myself. And at Smile & Co., we don't have white coats. That is intentional. Everyone has heard about white coat syndrome.
Mm-hmm.
So we abolished the white coats. We just have regular jackets. But anyways, I introduce myself as Ashley. I know that can seem weird if you are the doctor of your practice. And it's just what your comfort level is. I know what I had to do to earn my degree, and I don't need someone else to validate my achievements. So I introduce myself like, hey, I'm Ashley. It's so nice to meet you. Welcome to Smile & Co. And in that first, I don't know, 2 minutes, I'm trying to get some kind of rapport.
Mm-hmm.
And you build rapport right out of the gate by asking a personal question. And it doesn't have to be in like going down a rabbit hole of their life story, but something that you can connect on early on. And whether that is a hometown that they're from or like complimenting, I'm a big fan of just finding things that you can say that are nice to someone. And once you've made that connection, then I will lay them back and then start the exam.
I love that. You take the bib off too, right?
Yes.
Yeah.
So we have what's called bib on, bib off conversations.
Okay.
And first off, I think how you say things is extremely important, including the words that you use. So I actually never say bib. You know this.
Yeah.
We say patient napkins because a bib is for a baby. And even though we know some patients may feel like babies at the dentist and may act like a baby, they are not babies. So we say patient napkin. During the exam, I will have the napkin on. But and this is another thing, after I'm done doing my examination, I've gone through their radiographs and all of that, then I will seat them up and then I can remove the napkin. And that is a bib off part, a napkin off, where now I'm not a dentist and you're the patient. Now we're at the same level. And now we're just discussing how we can partner with each other to achieve whatever it is that we need to achieve with your health, with your aesthetic concerns. And I always will have the patient's chair slightly higher than my doctor's stool. So instead of the power dynamic being, I'm the doctor, I'm above you, I like to have them be slightly elevated so they appear, more powerful in that role.
You mentioned complimenting their smile.
Yes.
Yes. Okay. Yeah. So I know you want to come off authentic, right? But like you can always find something about someone's smile because people are so scared to come to the dentist's office and they don't like you already. And they're 90% of the time self-conscious about their teeth. So I think that's just like a great way to kind of make them feel comfortable. I love that. I don't know.
I think that you can find anything to compliment. Even if they have a mouthful of decay, you can say, I commend you for being here today. Today is the first step. And I acknowledge the fear and anxiety and what has kept you from coming to see the dentist for so long. And I just hope that you recognize that first and foremost. And then you can go from there. And so needless to say, their mouth can be falling apart, but you can always say you have beautiful lips, like you have a great foundation to start. You have, you know, it it doesn't matter basically what phase they're in, because we can always improve upon that.
That's great. This is kind of goes before even actually you walking into the room. I know for you, you like your hygienist and assistants also when they're introducing you. And because I know you said that you don't introduce yourself as Dr. Ashley, but when your team member introduces you, where do you like that team member to be standing when you come into the room?
This is huge. So, I mean, what do they say? Like 90% of communication is nonverbal. One of my pet peeves is when the assistant or the doctor is standing behind the patient and now you're having a conversation and now the patient doesn't even see all the players involved in this conversation. So you are quite literally talking behind the patient's back, which is a no-no. We have what's called a triangle of trust. So basically what that looks like is the patient is sitting in the chair. I'm sitting to one corner in front of the patient, and the assistant is also on the opposite side in front of the patient. So everyone at all times makes eye contact. And that is super important. And I know the day gets busy and team members tend to forget and all of that. But if we can just commit to that and have, I mean, you'll be surprised at what kind of case acceptance you would get if a patient actually felt like we were talking with them and not at them.
There's something I've noticed that you haven't mentioned that you do too, is you ask permission of the patient pretty much before you do anything. So before you look in their mouth, before you lie them back, before you start talking about the treatment they need, you ask permission of Mrs. Jones, do you mind if I lay you back?
Yes.
Do you mind if I look around? Do you find that that helps too? Like that, I think it just kind of takes patients aback. Like that is a difference.
Obviously they gave their permission because they wouldn't be in the chair, but just that simple act of, I respect your space. I respect you enough to always ask before I do something. We've gotten so many patients who are like, oh, wow, I've never been asked that before. And it's just one more thing that we are doing to make sure that it's unreasonably hospitable.
Yeah. So you've done your exam, you've talked to the patient before, during, and after now, and you've talked about the treatment they need. They need a lot of things, let's just say. How do you read that patient to know, do you overwhelm them with everything? Do you maybe just go to the next phase? Like, how do you know when you can do that with a patient?
So I approach every patient differently. And there's this phrase or this, I don't know how to describe it, but it's called mirroring.
Okay.
So if I walk into the room and a patient is quiet, just very soft-spoken, doesn't ask a lot of questions, I will take down my big personality and I will be at that same exact pace of tone. I'm speaking slower. I'm taking pauses. I'm asking more questions and trying to get them to engage. And I also, at the same time that I'm doing this mirroring, I ask them, I'm like, are you the type of patient that wants more information or less?
Okay.
Because if it is okay with you, Mrs. Jones, I would like to be able to tell you everything that I'm seeing. But if you just want me to give you the plan, then you just let me know. And then I actually let the person speak and they'll tell me like, hey, no, give it to me, doc. This is what I signed up for. Or if they say, I'd rather not look at my photos because a lot of patients don't want to see what's happening in their mouth and they just trust you because of all the reviews that they've read, or even better, they've been referred by someone who is already a patient of ours, then I already know that we've earned their trust. So everybody's a bit different.
I love how you said that mirroring though. And you're really good with communication just in general. And I think your whole life you've been that way. I worked in pedo for a long time. And I think you really have to have like, it's all just behavior management,
Yes.
right? Like you're
Yeah.
just kind of mirroring where that person's at.
Mhm.
And I think that that's like a huge thing to make patients comfortable. So exam part's done, their appointment's over. What do you like your team members to do when they walk their patient up to the checkout area?
Mhm.
Um, normally there's like a simple pass off
Yeah.
maybe, but
Yeah.
how do you kind of approach that to continue the experience of being like you're partnered with that patient?
Yes. So after the examination is done and the patient is quite literally passing off, we call that the transfer of trust. I encourage our team members to be on the same side as the patient while they are checking out. I think that positionally, it looks like we are your advocate. We are literally by your side. We are going to walk you through your treatment. And we partner with you instead of just doing a really quick pass off and the assistant goes on the other side and checks out. And I think it's just like like Nordstrom's, for instance. I love Nordstrom's. Everybody knows that Nordstrom does amazing customer service because that is taught. They are trained. And if you notice, when you purchase any item, they don't just give you the bag over the counter. They will take the bag, walk it out, and hand it to you right next to you. And I think that is like that lasting impression that patient is now going to leave with.
I love it. So that's not the last thing though. A patient leaving the office is actually not that end of their appointment. So what do you do?
We like to send handwritten thank you cards. And I know depending on the schedule, it can get backed up. But one thing that I really love to receive in the age of AI and digital and just instant everything, receiving a handwritten card a few days later is just that nice, like final kiss. Like, and if the team member or the doctor has had a really great experience with that patient, that is also our time. Like we're escorting the patient out, like side by side. I like to really thank them. Like, listen, Mrs. Jones, it really was such a pleasure to meet you today. And I just want to thank you for choosing us. I know you have thousands, quite literally thousands of choices when it comes to taking care of your smile and your health. And we really certainly appreciate your time today.
I love that. I think that's all amazing things and just things that set Smile and Co apart. And I think those are all simple per se, things that any doctor can take into their practice to really just like elevate that new patient experience.
Thank you. I think this AI will never be able to touch that one-to-one connection. Like and that has to come from, these aren't scripts. Like these are genuinely how we feel about our patients, how we feel about the patient experience. It's not just you're in, you're out the door. And you have all these treatment plans that, that now it's just a matter of what is your insurance going to reimburse. There's a reason why we are by far the most rated, highest reviewed in our area. And it's because we really think about what is it that we can do to take this dental experience to another level.
Love it. Thank you for sharing.
Thank you.
That was a quick episode. Hopefully we can do more of these little things. I think just snippets of helpful information.
We would love to hear what you guys are doing too.
Yeah, absolutely. And if you have any other questions on different things and what we can help with,
let us know. All right, guys. Thanks for listening.
bye.
Bye.
Hey friends, I just want to give some love to Net32 for supporting this episode. If you're a practice owner like me, you know the back end of running a dental office isn't always sexy, but it is necessary. Net32 is an online marketplace where you can compare brands, vendors, and prices all in one place. That means you're not overpaying or wasting time. And when you're building a startup or juggling multiple practices, every dollar and every minute matters. I've used Net32 and it's honestly made a huge difference. Check them out at net32.com/the making of.